Mr. Deputy Presiding Officer, pleasant good evening to everyone in this august body here at the chamber. I'm humbled to be standing here to address this distinguished house in this hallowed chamber with so much historical value attached to it. It's no secret that this debate is a very important one, and the views expressed here will go a long way in shaping the future of the island, and this is the purpose for which we have all gathered in this house. The original motion as presented today by the member for Darrell Spring Wim sought to present to this house a commendable projection in principle, but one cannot escape the fact that it comes at a time when this administration has already hit the ground running in getting Tobago's business fixed. We cannot in good conscience have a plausible exchange of ideas without paying close attention to opportunities lost along the way on this journey that has been paved by the entrance of the COVID-19 pandemic on the world. I am blessed, and we are blessed to work along with the distinguished Dr. Faith B. Israel, who at present is our esteemed Secretary for Health, Wellness, and Social Protection, and being a member of the team that leads in the healthcare arena for Tobago, I have been able to witness firsthand the results of blatant neglect in this area or in this division in this Tobago House of Assembly. It goes without saying that implementation of a policy is not necessarily a now-for-now kind of result. We must understand that all the variables involved in the process surrounding the issue have to be carefully thought out, and sometimes by trial and error, we arrive at a point where a policy is formulated, and this would concrete our course of action and set a governance model that we could work with. COVID-19 brought with it so many uncertainties and so many unknown variables that its treatment and our ability to chart a course was sometimes uncertain. However, there were certainties that presented themselves as early as May 2020, which were not addressed. One such certainty was the need for a parallel healthcare system. And due to the highly infectious nature of this disease, parallel healthcare systems were the order of the day in developed and developing societies. Even as close as our neighbor Trinidad, a parallel healthcare system was implemented. However, right here in Tobago, this idea was totally neglected.
.45.1, Mr. Deputy Presiding Officer. Irrelevance.
Member for Darrell Spring Wim, you will have your opportunity to raise this when you wrap up your debate. Continue, member for Buku Mount Pleasant.
Thank you, Mr. Deputy Presiding Officer. Due to the highly infectious nature of this disease, parallel healthcare systems were set up. So in Tobago, this was not the case. As a consequence, we saw where our healthcare system was challenged tremendously at our major facility, the Scarborough General Hospital, where clinics were cancelled and infected persons and persons suspected of infection were mingling in similar environments. Now, since our assumption of duty, led by Dr. Faith, we have been able to restore and develop, a parallel healthcare system. And it's evident in the numbers that are being reported daily as far as the pandemic is concerned. We are down to single digits, sometimes no death, sometimes one death daily over the last month. I am raising this to show where, as we have gone through this time of uncertainty, many opportunities went amiss by the previous administration. The Roxburgh Hospital, a facility that was hurriedly opened in December of 2020, not necessarily as a hospital, but as a vote bank, a vote bank, with the hope of creating a destabilizing effect on the political aspirations of our members in the East. We see that now, under the leadership of Dr. Faith and this administration, we are eventually finishing that facility, and soon it would be in use to serve the people in the rural areas of Tobago, and in due course, that area would not be termed rural anymore, for the development of the country is well afoot, because somebody lives there. Now, my point, Mr. Deputy Presiding Officer, is that any motion that seeks to rush this administration, any motion that seeks to create a sense of urgency with regards to Tobago's development must be met with justifiable skepticism, as the former administration stands guilty of seeking to create the illusion that they are concerned about the direction in which Tobago is heading, and that we need to move with haste in implementing strategies that they stand guilty of having multiple opportunities so to do and not working expeditiously at executing. It's all well and good for the Honorable Representative for Darrell Spring Wim, and you would like us to embrace this motion as presented. However, the variables that need to be considered transcend the simplicity of this motion. Has an impact assessment been done on the different expressions of remote employment? What is the impact? When persons decide to stay at home or in their gardens or in their places of comfort to work from their devices, should they suffer any injury, should they suffer any incident or accident, is there any provision for them to be compensated should anything happen while this is in train? Does a safety officer need to inspect the conditions under which employees function? If there are injuries, is there anything within the bargaining unit to protect these workers? Although the pandemic has left us literally no option in some cases but to work remotely, in some scenarios, and yes, we do have the technology and technological support to justify this approach, it would be wise for this administration to work cautiously while building out a policy to govern this option in the productivity scheme. It has been proven by research in some of the first world countries, persons who work from home have been suffering some ailments such as musculoskeletal pains, eye strain, mental health. Some people need to be monitored to work effectively. And these challenges have been brought about because without a structured approach to time management, workers have been found to do extreme things just to get and to meet deadlines. Recently, one of the richest men in the world predicted that another pandemic is on the way. His predictions are inconsequential actually in this conversation. The fact remains that productivity is important, results are important, and regardless of what the scenario is on the world stage, people must work for momentum to be maintained. However, the pace of implementation will be determined based on real considerations of all the variables and not on any ulterior motive driven by voices that missed out on their opportunity to implement these said ideas. They had the opportunity so to do and neglected to do it. So, Mr. Deputy Presiding Officer, we recommend strongly that the amended version of this motion be considered. We are in this house for the benefit of all the people of Tobago, and we intend to conscientiously and intelligently and prayerfully realize our mandate to the people of Tobago. I thank you for your gracious indulgence. Here is my contribution. Thank you.